Hello, this is Dr. Tim Rice. I wanted to give a few pointers on doing a normal fundoscopic exam. So what you see here is a beautiful photograph of a fundus, but the thing to remember is that when you do your exam, all you're going to see is just a small window into the fundus. So I hope to teach you a few tricks on seeing the fundoscopic exam easier. And the first part is just what is your expectation of what you're seeing, and remembering you're just going to see a small portion of what usually gets published on the internet or shown from the ophthalmology photographs. To start with, it's important to hold the ophthalmoscope correctly. I believe this is the easy way to hold the scope with the right hand when you examine the right eye, and then this allows you to get in good position and adjust the focus of the ophthalmoscope. Start with the ophthalmoscope at 0, and then when you're 12 inches or 15 centimeters from the patient, focus on the pupil so that you can see the pupil clearly, and you'll be able to then move in and focus on the vessels. So the process then is the right hand for the patient's right eye, the left hand for the patient's left eye. Make sure the room is dark and the patient should look over your shoulder. You focus on the patient's pupil, 15 centimeters, 12 inches from the patient. Move closer until your finger touches the patient's cheek, and then remember, because you're only going to see a small area, you need to move your head around to view all of the fundus. So again, a reminder, the left hand to examine the patient's left eye, and you'll see the patient looking up over my shoulder, encouraging them to look at one place. If they don't look at one place on the wall, then it makes it difficult as the fundus is moving around as you're moving around. Notice I've moved in, and now my finger is touching her cheek. So as you navigate in to the fundus, you need to move the focus until you can clearly see one of the vessels, and then trace the vessel and you'll see a branching. Imagine putting an arrow in that branch, and that will direct you to the optic nerve. When you start looking in at the patient's fundus, you'll be looking to the nasal side of the patient's eye, and the optic nerve will be then lateral to where you start looking, and so just following the vessels to the optic nerve. As you get closer to viewing the optic nerve, your head may somewhat obscure the patient's visual field on the side you're looking at, but hopefully the patient will be able to maintain her focus or his focus with the other eye and not move the eyes around. So what's going to happen is your head is going to be moving up and in, and you should be able to see the optic disc and cup. So this is a patient with papilledema, and this is the patient's right eye. You can see the fovea here, and then this is a patient's left eye. It's a different patient. And here, this is a normal eye, and they have a nice crisp optic disc, and the cup is very small, so it's a 0.2 cupping, which is normal. retinal neovascularization is present here on this photograph. So just a reminder, using your hand like this, the left eye, use your left eye to look in the patient's left eye and your left hand. Adjust the focus and you should be able to see at least a part of this, watching for venous pulsations, getting familiar with what the normal looks like so that when you see something that's abnormal, you'll know, oh, I need to get a second opinion about these abnormalities that you might run into when you're examining a patient.